And get started with our PMR healthcare meeting. Today's date is June 24th, 2025. The time is 11:17 a.m. In attendance are Commissioners Eberline, Duncan, and Matari. I'm going to call this meeting to order. Are there any changes to the agenda? Hearing none. Public comment? Hearing none. We'll go into our first item. It's a biannual report for the Kootenai County Member Health and Wellness Clinic covering July 1, 2024 through December 31, 2024. And who would like to start here?
Hi, my name is...
Sorry, push the microphone button. Just, yep. Perfect.
Perfect. Hi, my name is Natasha LaForce. I am the Regional Operations Manager for PMR Clinic. I am here today with our PMR team, Todd Fouché, to go over the report. What we have is a highlighted version of this report, and I also do have the full report available. If you have any questions, we could go a little bit further into that as well. But we will start off with some high-level key points, and then any questions are welcome throughout the meeting as well.
Excellent. Now that I've seen the layout a little bit, it's okay.
Absolutely.
Quick handout. It's a little bit easier for us, and hopefully for you as well.
Thank you, Scott. I'm sorry, Todd.
For the report, the biannual report in general, this is a 50-plus page document, so we try to narrow it down to some key elements to share today. And as Natasha mentioned, there's certainly more detail we could toggle over to as well.
You may have to stand behind the table because the microphone won't pick you up.
Okay.
Or the podium. You could stand at the podium if you'd like.
I think I will.
We'll have to turn that one on. Oh, I think it should be on.
It's on.
It's on.
Very good. On the handout that I provided there, it's been a while since we've had the pleasure of chatting in person, but on that first page at the top, I just wanted to restate some of the objectives. It is only some of the key objectives in part, but one of the main goals was providing access to a primary care physician to the county employees on the health plan and their family members. In addition to, it was improving access to appointments, because in the open market in general, it's 8 to 10 weeks in many instances to get an appointment with a primary care physician. And with the PMR clinic that services your employees on the health plan, those appointments are generally immediate being a day or two at most in order to get a scheduled appointment. So there's ease of access for appointments, access to a physician that's dedicated to the members. Point C there was some of the focus was early detection of medical conditions, was one of the benefits of providing the care, and also disease management services for those who have chronic ailments that are going on. There is a cost savings component. When we look at the office visit charges, the labs that are run or processed as a part of an office visit, and the medications that are dispensed in the clinic, the detailed report will show those unit costs through the PMR clinic versus the cost had those same services been billed through the health plan. So we'll be able to see savings in that regard. And then one of the other key points is members, when you access the primary care visits, or if there's any medications dispensed, there's no out-of-pocket for the patient at the time of those visits. So you're trying to remove a financial barrier if someone's avoiding healthcare because they can't afford it. For example, you're eliminating that because there is no out-of-pocket for the visits to the PMR clinic side. So I just wanted to revisit some of the key objectives. It's not the complete list, but some early on when we first started dialogue and when you were evaluating the clinic, these were some of the key components that we were talking about at that time. On section 3 there on that handout, the middle of that first page, after the first 6 months, there's been 1,990 visits to the clinic, office visits that have been scheduled. New patients, about 406 different individuals that have sought care from the clinic so far. That represents about 33% of the employees, about 16% of the dependents so far. Not unusual when we start other clinics for other employers, very common. And each quarter, I believe that we'll see, even on the second biannual report that we review, you'll see those percentages increase. And that's normally what happens quarter over quarter. People come accustomed to the clinic. There's additional communications that are sent to employees that continue to encourage them to use the clinic. Word of mouth, quality office visit with the physician, et cetera. All of those things will continue to drive the utilization up. During those 1,990 visits, there were 282 individuals that specifically had a complete physical that was done. And that helps us with a lot of early detection. And we're going to speak to some of those things that were early detected, certainly in a HIPAA compliant manner, not names, but just share some of what was presented itself early on in the first 30 days, even when the clinic opened. To break that down, 1,990 visits, there were 645 different medications that's been dispensed in that period of time, 4,900 plus labs that had to be performed during those office visits. And once again, we'll speak to some of the specific early detected items. But from a referral basis, the key referrals were if the care was beyond the scope of the primary care physician, then was assisting the patients to set up appointments and referrals to those specialists. And some of the key specialty services was orthopedics, gastroenterology, dermatology, that presented themselves on a frequent basis. So, I mention that because there are patients that are presenting themselves with comorbidities or complex medical issues, cancer diagnoses that have occurred, but once again, some of those gastroenterology, dermatology, orthopedics are some of the more common reasons for referring for specialty care. The benefit of the physician, Dr. Doxy, is that once the patient is referred out, then we can follow up with the patient on that specialty visit, and once again, keep as much of the care within the primary care realm as opposed to the specialty realm, which is generally billed to the health plan at a higher cost. So it's managing those dynamics a little bit. From a savings perspective, after it was about 5 months, 3 weeks of care so far, we're netting about 142,000, a little bit more, 142,500, just a little bit net of fees. So, and the way we calculate that is once again to take each office visit, each lab, each medication that was dispensed, and showing what our unit cost is compared to have those same services run through the health plan. And you're getting a sense of where the unit cost savings, and then we net out what you're paying PMR. And that 50-plus page report that I referenced, part of that, the length of that report is literally showing every line item of service so that you can objectively back into it.
Todd?
Yes.
Can I ask a question on that? This is Scott Burkhart from Alliant, by the way. Would it hold true if we annualize that? Would it be 280,000 theoretically for the year savings, or does that follow through?
You could make that leap, but the potential for it doubling could be twice that number after the following 6 months.
Okay, so that's not already annualized. It's a 6 month
It's just
figure.
for the first 5 months, 3 weeks.
Okay.
Yeah, but it could be bigger too, because we're on a growth, right? We're bringing in more patients. So
That's right.
I would argue that's a much smaller number than what we should see
Yeah.
after this calendar year or this fiscal year.
Every time the utilization goes up, the more services that can be directed through the clinic, the more the county will benefit on the financial side. That's exactly. I'm going to ask Natasha if you will speak to some of the patient survey feedback.
Yeah, absolutely.
Comments and maybe some feedback from Dr. Doxy. Certainly a good place to segue.
Sure, absolutely. So I oversee the clinic, so I get a lot of experience and hear the patient care, and especially from Dr. Doxy. What I can say is everybody really loves Dr. Doxy. He is doing fantastic. The patient appointments are increasing. We are staying very, very busy. Patients are coming in, a little skeptical at first, wanting to know what it is. And when they know that we will work in conjunction with their primary doctor, who maybe they've had for 20 plus years and don't want to leave, we end up getting them to us. So I have on here some of the feedback that I'll pull up just so you could read off to the side. But they love his approach. They love how the clinic, you can go in there and you can have 45 minutes to an hour with a doctor and actually sitting and speaking to them without them being on their computer. They're enjoying the amount of services we're providing, whether that's medicine, and they're getting that as they walk out the door with a sick child or if they're sick themselves, and also the labs that we are performing right then and there. So the services and kind of this one-stop shop that we'd like to have for them and have all of this, patients are very happy. They're very, very happy, and they're enjoying it. Anytime I see them, I've seen some members of Kootenai County, whether it's the sheriff department or things, out in my personal life, and they recognize me. They speak very highly of Dr. Doxey in the clinic. So they're really loving it. We're very excited.
It's an opportunity when each patient has a visit, they have an opportunity to provide us feedback on their visit immediately following. So it is subject to how many of them take advantage of that, but we do collect that feedback from them, or they have, once again, the opportunity to do that after each visit. And when some of the scores that are here, that is, we can go down and show you the actual questions that are asked. They're rolled into these percentages that are showing, but these percentages are all 96, 97+%. And when you compare that in the open market's generally in the 85 to 86% range versus 96+%. So it's just an indication of a little bit of that just direct time with the patient. They're not rushed in 5 or 7 minutes. They usually have 20, 30, 60-minute appointments. So it's just all of it together is what creates that good environment that allows you to diagnose, treat, manage diseases, help with referrals, et cetera, which are some of the things we chatted about, the value proposition, but now are coming to fruition through the actual care that's being provided.
And we, as a clinic, along with the doctor, are working in conjunction with Kootenai Health and Northwest Specialty, and having meetings, meeting their specialists to connect and network a little bit better. So we have ease of communication with them, along with the benefit plans that you guys have. So the Edison program, we've done extensive training with our staff to ensure we're utilizing that, along with the EAP benefits as well.
Would you like to share, Natasha, a little bit about some of the early detection findings?
Absolutely. When we opened up, we had quite the uptick of patients coming in. So all of that's usually new patient appointments where they have that 90-minute visit, which includes the full blood panel and any concerns that they're having. Out of that, for the first 3 months, we had an early cancer diagnosis purely from our labs. The patient did not have any symptoms. He just came in to have lab work done, and he was found to have some concerning lab work, sent to a specialist, and early cancer was diagnosed with that. We had a bunch of uncontrolled diabetes that came in, patients just not feeling good. They don't know why, they think they're just worn out from the day or anything like that. Lab work came back. Dr. Doxey was able to get them treated and has been able to maintain their treatment through our 1, 2, 3, 6 program that we have implemented. Mental health has been a very big piece of this as well. A lot of patients are utilizing us when they can't get into a specialist or a therapist for weeks at a time, or even their normal PCP, so they're seeing Dr. Doxey. He's utilizing the EAP benefits for the health plan and then getting them on medication, which can take a couple weeks to get into your system, and then getting them to a specialist to talk further. So a lot of that has been a huge uptick with us and continues to be. So patients are coming in, I haven't been to the doctor in 20 years. I don't know why I feel good. I don't know why I can't lose weight, or I'm losing too much. And he is finding things that they never knew they had. So it's been really great.
Part of the additional benefit of that is that if we can early diagnose a cancer, perhaps in stage 1 versus stage 3 or 4, for example, not only the quality of life for that individual and their well-being, but those examples are a pre-diabetic that you're able to keep in a pre-diabetic state and not become another insulin-dependent diabetic on the health plan, are all examples of individuals that we can help minimize those who get 50% of your specific deductible, or maybe actually get the specific deductible. So it's constant connection to the health plan and how it benefits on that side as well. But these are examples of things that presented themselves, and I think even many of them in the first 30 days that this clinic was open and continued at this point. There's about 16 to 17 patients per day right now that are accessing care. There's some peaks that are occurring. I understand earlier this week or last week it actually exceeded that somewhat. And there's certain things that drive that. To the earlier comment that was made, the more we can encourage utilization, the more the patients have a good quality visit with Dr. Doxey, that will continue to grow. it's commonly what we see, and then we'll continue to have success stories on outcomes. Hopefully they'll continue to show additional savings, net of any fees that are paid. Patients have quality care at no out of pocket, and once again, everyone benefits from the service. But it's been a great start for the first 5 months. Questions for us?
Any questions? I'm just kind of curious, at what point, how many patients per day until you start to peak out?
So typically what we do is we plan when the clinic opens, right, there's that uptick, that backlog of patients, and then it kind of starts trickling down. We have not been trickling down. We have been maintaining that. I do not foresee it right now having too much of a dip. We have holidays, things like that, where it kind of slows down, vacations. But we've been maintaining around that average of 16 patients a day since opening.
Okay.
And it is getting busier. We have more and more people calling, so.
Okay. And then if you were to index compared to other clinics that you've opened, where do we rate on that with respect to new patients and cost savings and things like that?
Go ahead.
Multiple sides. I think of it from the operational side and Natasha from the clinical side of it, so we'll both probably have some comments in that regard. When I look at all the clinics that I work with across the country, actually the utilization at your county clinic is slightly higher. From a savings perspective, it's very consistent with what we normally see as we go through. And it's all because your data was reviewed in detail before the clinic was ever open, which is what helps us to actually really define that early on as to what's to be expected. And part of what we would have presented to you early on to help assist you to decide whether to adopt the clinic. And in all fairness, Bruce, it's coming in almost exactly what was projected.
What was projected?
Yeah, except your utilization is slightly higher. Right at
Okay.
this point.
So we're ahead of the curve a little bit.
This clinic, between all of my clinics, is the busier one.
Okay, so I think one of the things we were talking about is getting upwards of, was it $1 million a year in savings?
Yeah, I think that was a 5-year average goal.
Yeah, so we should hopefully see, maybe $250,000 or something in a 12-month period?
I think that's what it's trending towards, yes.
Hopefully it'll even be greater. And then at that point, we will even be more intelligent in regards to what other things we can actually bring to the attention that the clinic is specifically saving the plan. So, but yeah, I mean, we should see that trend up to about $250,000 at this point, which at the point where patients are just coming in for their physicals and establishing a relationship and then building that over time, managing those diseases, we should continue to see those numbers rise.
Okay. The only other comment I would have is that I've just gotten some feedback, and it's anecdotal. Maybe that operationally some things could be a little bit more efficient with trying to call, trying to reach people, get stuff like that. And I largely attribute that to just kind of getting all cylinders firing, if you will. But I think it's important to have a feedback loop so that people can feel comfortable that they can provide that feedback if I'm having a problem getting a hold of someone, or I've been asking a few times that I'd like to see A versus B, and get that feedback. So maybe we can talk about, whether that's just a little card that gets put in a box that goes to the commissioners or something.
So we actually have a suggestion box that is getting put into the clinic. They just arrived today, which includes some forms of good and negative feedback if anybody has them, or just any kind of neutral feedback. So that's what actually getting implemented in clinics right now.
Okay, and all of that will be delivered electronically to the board?
We will put it, because it's on paper, and then I'll send them over to the PMR marketing team, and then we can get them put together.
So we should have a couple of ways through the suggestion box. And then earlier I made the comment about the surveys that the patient, those surveys really drill down to specifically those questions about availability and scheduling time and professionalism of the staff and the care provided by the doctor. So now the latter is only as good as the patient's completed, but between that and the suggestion box, I think we can provide that feedback loop, the details about the feedback that's coming in.
Absolutely. I just hope that feedback comes to the board.
Sure.
So that we can see that. and other elected officials for their employees. So, okay. Any other comments or questions? Do we need to go into executive session?
Is that only? Was executive session only to go in the detailed report?
Yes.
Okay, because I've been through the detailed report and I didn't have any questions, so.
Yeah.
Did you?
So,
Nope.
okay, then we don't need to go into executive session. So thank you so much. Appreciate you coming out. I think that's our only item for this meeting. Unless there's anything you wanted to add, Scott, or?
I don't have anything to add at this point. We've got our July 15th board meeting, I think, where David Smith will go into the Alliance side of the numbers and the budget and such, and we'll be discussing the clinic and such as well at that time. So.
Okay.
July 9th, sorry.
And then I guess when would we expect our next set of numbers? Are you just doing it on a biannual basis every 6 months? What?
The, currently, under the contract, there's these two formal semi-annual reports, because then you get to report on trends and patterns.
Okay.
There are reports that can be done more frequently, and if that's, it's an abbreviated version of this detailed biennial report, but if that's something you feel like you have interest in, we could outline that for CK and then make a decision with the commissioners of whether or not you'd like to go that route as well. So there is the two semi-annual reports under the contract, but there are monthly abbreviated reports that could be done. It would just be, if we do the monthly reports, then we do one large annual report that gets into the medical issues more, or it's the two semi-annuals. So it's whichever fits your needs better. But we can take that offline with CK if you prefer.
I'm fine with the two reports. I was just,
Biannual.
yeah.
And
But I
with
just didn't know if we had to wait 6 months, like we're going to get our report covering December to June and December. Is that, we get it sooner than that?
It'll take a little bit after that, only because we then have to take every one of those office visits, labs,
Yeah.
and prescriptions and compare them to the health plan.
Oh,
And that's
okay.
where the time takes. It takes a little bit of time so that we can actually identify what the savings numbers are.
Okay.
And I will be receiving a date, so there's not going to be this waiting. I'll be able to give CK when you guys will expect that report.
If that poses any questions, happy to field that. If that poses any questions.
No, I think this is a great program, and it's going to save the county money ultimately. It's going to provide a better service for the employees. And, you know, one of the things we always talk about salary surveys and stuff like this, you know, this is a huge benefit that we offer. And I don't think it gets the kind of quantification, if you will, from a dollars and cents from a benefit side that it should. And so I appreciate that you guys are doing it and that we're able to offer it.
And thanks, true thanks from everyone at PMR Healthcare and Alliance team for the opportunity to provide the service. So we look forward to the next conversation, and certainly in touch with CK, and hopefully Sylvia will be back in the very near term. But thank you for the opportunity.
Well, thank you for coming out. So if no one has,
I will piggyback on Bruce's comments there. It's the definition of value. This clinic has changed the definition of value for our employer clients. You know, we're no longer just looking at the cost of the medical plan. It's how do you place value on a cancer claim, early diagnosis that, you know, where a major claim didn't happen, right? What's the value on that, or a life saved, you know? Yeah, we're seeing incredible results across all our book that we've implemented this clinic, and yeah, we're really excited. The Kootenai clinic has seemed to perform best among all our clinics. So, and I think the staff, Dr. Doxy, is a key reason for that. All are operating well, but the Kootenai clinic is doing really, really well. So.
well, it's good to hear we're number one. So, okay, well, if there's no other comment or questions, thank you very much for coming out. Next up, public comment. Hearing nothing, 11:41, meeting adjourned. Thank you.